Your dog is limping and you're panicking. Do you rush to the emergency vet right now, or can you wait and see if it gets better? In the next 6 minutes, I'll give you a clear decision framework so you know exactly when limping is an emergency requiring immediate care and when you can safely monitor at home for 24 hours. All information is sourced from VCA animal hospitals, PetMD, and veterinary emergency guidelines. Let's break it down. Here's what we'll cover. Emergency signs that mean go to the vet now. Wait and see signs where you can monitor for 24 hours, how to safely examine your limping dog at home, what first aid you can provide, and common mistakes pet owners make. Before we start, this is educational content to help you make informed decisions. It's not veterinary advice. When in doubt, call your vet or emergency clinic. They can help you decide urgency over the phone. Let's start with emergency signs. These mean you need to see a vet immediately, not tomorrow. If your dog won't put any weight on the leg, that's a non-weight-bearing limp. Most dogs won't walk on a broken leg, torn ligament, or dislocated joint. If the leg is dragging on the ground or you see an obvious broken bone or joint at an awkward angle, this is an emergency. Severe swelling or deformity is another red flag. If your dog is yelping, whining, or showing signs of extreme pain, don't wait. Bleeding from the leg needs immediate attention. And here's critical. If limping is accompanied by lethargy, disorientation, vomiting, or breathing difficulty, these could signal serious systemic problems. Go to the emergency vet. What should you do? Call the emergency vet immediately. For transport, support small dogs' heads and hips. For larger dogs unable to walk, use a blanket as a sling to carry them. Don't force them to walk if they're in severe pain. Now let's talk about wait and see signs. These mean you can monitor at home for 24 hours before calling your regular vet. If your dog still puts some weight on the leg, that's weight-bearing. It's a mild limp with no other symptoms, no visible injury, swelling, or major deformity. Your dog is still eating, drinking, and acting relatively normal. The limp had gradual onset, not sudden. Important rule: if the lameness persists for more than 24 hours, you need to seek veterinary care even if it seems minor. 24 hours is your guideline, not a week. During that 24-hour monitoring period, confine your dog. Restrict activity to leash-only bathroom breaks. If there's swelling, apply an ice pack for 15 minutes. Watch for improvement. If it gets worse or doesn't improve, call your vet. And how do you examine your limping dog at home? First, safety. You need 2 people, 1 to examine and 1 to restrain. Dogs in pain may bite even people they love. If your dog is in severe pain, skip the examination and go straight to the vet. Start with the paw. Check between the toes for thorns, splinters, or grass. Look for redness. Check the pads for cuts or punctures. Examine each toenail for breaks or nail bed infections. Then work up the leg. Gently apply pressure starting at the toes, moving upward. Most dogs will pull the leg back when you touch the sore spot. Bend and flex each joint. If your dog resists, that's a sign of pain. Compare to the other leg. If something looks or feels unusual, checking the unaffected leg helps you identify what's different. Look for swelling, heat, wounds, or areas of tenderness. Here's a pro tip. Record video of your dog walking. Dogs often hide limps at the vet's office, so video evidence from home helps with diagnosis. Yike. Let's talk about causes briefly so you understand what might be happening. Sudden onset limping usually means injury. Paw pad cuts, torn nails, foreign objects stuck in the paw, sprains, strains, fractures, or torn ligaments like ACL tears. Gradual onset limping often indicates chronic conditions: arthritis, hip dysplasia, elbow dysplasia, or patellar luxation where the kneecap slips. Other causes include tick-borne diseases like Lyme, infections, abscesses, bone cancer more common in large breeds, or insect bites. Here's the key. As a pet owner, you can't diagnose the cause. You can only decide if it's an emergency now or a vet visit soon. What first aid can you provide at home? If you find a foreign object in the paw, remove it if easily accessible. Use tweezers for splinters. Clean with antibacterial soap and warm water. Apply antibiotic ointment if you have it. Bandage if needed. For mild swelling, apply an ice pack wrapped in a towel for 15 minutes. Repeat every few hours. Do not use heat for the first 48 hours. For all limping, confine your dog, crate rest or keep them in a small room. Restrict activity to leash-only bathroom breaks. No running, jumping, stairs, or rough play. Watch for improvement over 24 hours. What should you never do? Never give human pain medications. Ibuprofen and acetaminophen are toxic to dogs. Don't give any over-the-counter medications without vet approval. Don't force your dog to walk if they're severely painful. Don't manipulate broken bones or dislocated joints. If home care isn't working and the limp doesn't improve in 24 hours or gets worse, see your vet. Common mistakes pet owners make. Mistake 1. If my dog is still walking on it, it can't be serious. Not true. Dogs are tough and sometimes walk on painful injuries. Look at other signs like swelling, pain level, and behavior when resting. Mistake 2. I should give my dog aspirin for the pain. Never give human medications without vet approval. Many are toxic. Call your vet for safe pain management options. Mistake 3. Limping that comes and goes isn't serious. Actually, intermittent limping often indicates chronic conditions like arthritis or hip dysplasia. These need vet evaluation and management. Mistake 4. If there's no visible injury, I don't need to worry. Many serious injuries are internal. Torn ligaments, hip dysplasia, bone cancer. You can't see these from outside. Persistent limping without visible cause still needs evaluation. Mistake 5. I should wait a week to see if it gets better. 24 hours is the guideline. Waiting longer delays diagnosis and can worsen outcomes. Recap. Emergency signs mean go now. Non-weight-bearing limp, severe pain, obvious fracture, or other symptoms like vomiting or lethargy. Wait and see signs mean monitor for 24 hours. Mild weight-bearing limp, no other symptoms, gradual onset. Examine safely at home, starting with the paw, working up the leg. Provide first aid, remove foreign objects, ice for swelling, confine and rest. Never give human medications. And if limping persists past 24 hours, see your vet. You now have a clear framework for making the right decision when your dog starts limping. When in doubt, call your vet or emergency clinic. They can help you decide over the phone. If this video helped, give it a thumbs up. Drop a comment if your dog has ever had a scary limping episode. I read everyone. Thanks for watching, and remember, when in doubt, call your vet.